There are currently 2 hospitals being repurposed or renovated to take care of Oklahoma's military veterans. Steve Shaw toured one of those facilities this week, and he joins us now with more on what the federal government is doing to meet the urgent need for more VA beds. Steve.
Taylor, Oklahoma's VA normally helps around 75,000 veterans each year. Oklahoma City's VA system director says in the past year, they've already seen 8,000 more than that.
Oh yeah, it's a Monday, folks.
Dylan Perkins is a 2015 Westmore High School graduate who immediately joined the Army. A year later, during a mission in the Philippines, Dylan was carrying 150 pounds of gear on his back when he fell down a mountain, breaking his back and neck.
Julie, sit. Julie, stay.
Now 26 years old, Dylan's 100% disabled and spends a lot of his time volunteering with his service dog named Juliet at Honoring America's Warriors in Oklahoma City.
It's saved my life. She's saved my life more times than my therapist has, and I mean, in the last couple of months, I've gone through it. The medications they had me on, I've been in and out of the ER.
Dylan and his wife Alyssa live closer to Norman than they do Oklahoma City, which is where Perkins currently gets the VA help he needs. 5 months ago, the VA announced it bought this 50-bed, 40,000 square foot hospital, previously known as Norman Specialty Hospital on Robinson Street in Norman.
It was pretty interesting to see how
Oklahoma City VA Healthcare System Director Wade Blossage says the new Norman facility will be called the Norman Regional Medical Center.
ever since COVID happened, a lot of our rural network has started to collapse in the state. And so there's not very many private sector places for veterans to go. So the VA here in Oklahoma City is trying to reach out to veterans and bring their care closer to home. We have run out of space at our main hospital for inpatient services, nursing home services, and also mental health services. And so what this new building will allow us to do is to build a 29-bed inpatient substance abuse treatment facility and a 29-bed short stay nursing home facility. And those are desperately needed within the VA right now.
It will still be 2 years before the Norman VA Medical Center opens, and that's only because they've still got a lot of work to do here.
And so this will be a great place, a very healing environment when they're done. They're going to redesign a lot of the functions here, but there's outside courtyards for the veterans. They'll have mental health providers, they'll have physical therapists, geriatric providers, and we're going to be working in concert with the Norman State Vet Home that's just down the street.
I think going to help thousands of veterans and giving them an outlet that otherwise wouldn't be there. You know, it's giving them somewhere that they can go when they're in need. And it's other than the downtown emergency room, it's somewhere a little bit more central for them and specialized to their needs.
So we are one of the highest growing facilities in the nation right now. We're second to San Francisco. So we've seen over the last couple of years 23% growth in much of our outpatient workload and our veteran patient population. What we've been able to do is we've been able to take some of our, like the beds that were left here that are in really good condition, some of them brand new, and give those to our tribal partners or Indian Health Services, and they'll be picking those up in the next few weeks. And so not only have we done this property or built this up, but we're able to give a lot of these equipment to those in need.
In downtown Tulsa, the state recently handed over this office building to the Eastern Oklahoma VA healthcare system. That building sits next to Tulsa's Oklahoma State Medical Center. VA spokesman Marcus Webb says the VA is partnering with OSU on a 58-bed VA emergency room and inpatient facility.
So one of the great things about this project is that we're going to be working closely with them to help expand their residency programs. So one of the things that we'll be doing there is having some residency training programs and basically just having them walk across the street to learn and train with us.
Webb says a new federal law makes veterans who've been exposed to toxic chemicals and even Agent Orange eligible for benefits. And he says the numbers of veterans on this side of the state who need help has also shot up.
And here at this hospital, one of the reasons why we pursued this project was because the majority of our veterans here in eastern Oklahoma do reside in the Tulsa area and surrounding communities. So we knew we needed to make a bigger footprint and have a bigger footprint here in the Tulsa area so that we could best serve our veterans.
Julie, you need to go outside, go potty? Oh, I'll take that.
Dylan Perkins says with 22 U.S. veterans still committing suicide each day, help like this will go a long way.
By the grace of God and the love of my family, and there's a reason the suicide rate that there's 22 a day. I firmly believe, that number's what it is because there's not people that are constantly checking in and helping these guys and girls, and I'm lucky enough to have a wife that loves me and parents that dropped everything to be at the hospital with me when I need them.
And we're really excited about what that's going to mean for not only our veterans but also the healthcare in Oklahoma.
That Tulsa VA facility will be ready in late 2024 or early 25.